I'm Dr. Jason Wilson, an emergency medicine physician here at Tampa General, and I'm really honored to have the Lieutenant Governor and this other group of representatives from Tallahassee that you'll also meet today. I'm going to introduce the Lieutenant Governor and let her speak and get us started. Lieutenant Governor Jeanette Nuñez is here with us, and she was born and raised in Miami. She attended Florida International University, where she's a proud graduate of that university. In 2018, she was elected Florida's first Hispanic female Lieutenant Governor. And in that capacity, she's worked with Governor DeSantis to oversee Florida's health policy across state agency lines. Prior to serving that role, Lieutenant Governor Nuñez was a member of the State House. She chaired several committees, and she served as Speaker Tempore of the Florida House. She's always had a passion for healthcare. She started her career at Jackson Health System. She oversaw the hospital's advocacy efforts at local and state and federal levels, and she helped lay the groundwork for opt-out HIV hepatitis C testing at Jackson. She held a similar role for the Hospital Corporation of America as well. Lieutenant Governor Nuñez has been engaged in almost every health policy discussion held in this state over the last decade. Her work includes improving and updating the testing laws in our state, promoting linkage to care in the HIV hepatitis C community, and ensuring support for postpartum women in our Medicaid system. Lieutenant Governor Nuñez knows public health, and she's a strong advocate, and we're really happy to have her here today. Lieutenant Governor.
Thank you. Excellent. Well, good afternoon. Thank you, Dr. Wilson. It's a pleasure to be here at Tampa General with such great healthcare leaders. We had the opportunity to meet in Tallahassee and discuss very important initiatives that the state is working on in partnership with hospitals, not just here, but throughout the state. And I think those are the partnerships that are really going to lead Florida to better outcomes. As we know, today is a National HIV Testing Day, so it is indeed a pleasure to be here to talk about the importance of HIV testing. National HIV Testing Day is an annual observance which encourages people to know their status. That is key. We need people to understand the importance of knowing their status, and also an opportunity to recognize the important partnerships, the community partners that we work with to make sure that HIV testing is simple, it's accessible, it's affordable, and it's routine. Because as I mentioned, testing is indeed critical. And so an earlier diagnosis of HIV, quite simply, leads to saving lives and more successful health outcomes. So as the Florida Department of Health and I are joining public and private partners around the state to help provide all Floridians with the access to tools that will indeed save their lives and help them to stay healthy. So today we're also here to highlight the efforts being carried out throughout the Florida Department of Health and their partnership with Tampa General, specifically through Gilead Sciences' Front Lines of Communities in the U.S., or their FOCUS program. Since 2016, the Florida Department of Health and Gilead Sciences have worked with partners throughout the state, including right here, Tampa General Hospital, to implement routine HIV and hepatitis C virus screenings as a tool to help end the HIV epidemic in our state. Florida is no stranger. Like many other states, we have seen those numbers, and we are concerned from a public health perspective of how we can engage the community, make sure individuals, again, know their status, get access to testing, and be able to lead healthier lives. So as Lieutenant Governor, working on this issue has been a priority for me. As was mentioned, I spent 8 years in the House, and I also worked on a number of initiatives to address HIV and other sexually transmitted diseases. So my focus over the last several years as Lieutenant Governor has been to ensure that our state increases awareness, that we are taking on the task of HIV testing, making sure we have treatment, prevention options, and taking actionable steps to end the epidemic. That's something that I know our Surgeon General is focused on, and we're going to continue to take steps to make sure that we do that. So participation in events like this, on days like today, are critically important as we work through our collaboration with such great partners that are here in the room. As we know, in 2016, we embarked and endeavored on an end the epidemic, HIV epidemic, by 2030. This initiative is part of the importance and the focus of Gilead Science. So all of these are critical components in moving our state forward on this very important public health issue. As I mentioned, Florida has made great strides, and we're proud of that, but we also recognize that there's still work to be done. So HIV testing, care, prevention, education are all important steps that are part of the pathway to eradicating and eliminating HIV transmission in our state. National HIV Testing Day is an excellent opportunity for us to remind each other to not only keep up the good work, but to continue to push forward the importance of testing. I cannot stress enough. So again, it's my pleasure to be here to show support to the Department of Health, to folks that are important partners, Gilead Science, to our hospital community, and making sure that these crucial collaborations continue, that we continue to expand upon them, and we look for ways to encourage individuals to know their status. Again, thank you all for the work that you do. Those of you on the front lines are the ones that are truly making the difference. We're here to support. I am honored to introduce our state Surgeon General, who has, how long have you been with us now?
It's been, I think, 8 months.
8 months.
So.
I'm sure it feels like 8 years. But our state Surgeon General, Dr. Joseph Ladapo, has brought a unique perspective on health and wellness, not just on this issue, but across the spectrum. So we're thrilled to have our leadership from the Department of Health here. And with that, I'll turn it over to our state Surgeon General.
Thank you very much, Lieutenant Governor. And thank you, Tampa General Hospital, for inviting us here. And thanks, Dr. Wilson, for your leadership with this. The Department of Health really, I mean, I personally feel really honored and I'm very grateful to have the opportunity to lead the Department of Health, because something that's important to me is preventing disease, but also treating disease. So we can support people to do what we can to help prevent disease, but also taking care of people who have illness. And very simple tenets and very appropriate tenets for why we're here today. So with National HIV Testing Day, we're obviously focused on HIV, and the Department of Health has an aggressive program with HIV in terms of both prevention and treatment. Specifically with prevention, we have programs for pre-exposure prophylaxis, which is a technology that was literally developed during my time, sort of as I went through college and medical school and residency, and now we know is very effective at helping prevent HIV. And also with treatment and connecting Floridians who are newly diagnosed with HIV with treatment. Another piece of prevention is testing, of course, and that's the focus of our special day today. So with that, and thinking about our partners here in Gilead and the Focus program, which is a way of linking both HIV and hepatitis C testing and then linking patients to treatment, we have a very common sense, straightforward, effective strategy for addressing a substantial component of the HIV epidemic in Florida. Something like 1 in 8, basically somewhere between 10 and 20% of people who who have HIV are unaware of their diagnosis. And these individuals contribute disproportionately, over half, we've been kind of talking about the numbers, but at least half of new HIV cases originate from people who didn't know that they were diagnosed with HIV. So effectively identifying people earlier is going to be an effective strategy. And Tampa General Hospital, again in partnership with Gilead, and also at a few other sites in Florida, are making a difference in this, and a meaningful difference for the health of Floridians. So I think it's, we can keep that in mind and kind of keep our eye on the big picture, which is expanding access to programs that are effective at reducing the burden of HIV in Florida. And I'm happy to be here, especially with our Lieutenant Governor, who's incredibly committed to public health, and also our partners at Tampa General Hospital and our leadership in the Department of Health, our clinicians. Thank you.
Thank you, Surgeon General. I want to tell you a little bit about the journey of how we had this innovation at Tampa General and how we got to where we're at. I had wanted to do HIV and hepatitis C testing really since the CDC guidelines changed in 2006. So starting as a medical student, I had tried to bring some type of HIV screening into our emergency department. The importance of HIV screening in an emergency department is that we can reach people that other people don't see. We can reach high volumes of people every day. And we can also know that the earlier we identify somebody who has HIV and link them to care, the quicker we can get them onto treatment and get them cured get them managed on their virus and stopping from transmission and cure of hepatitis C. So stopping transmission of HIV and cure of hepatitis C. So with that in mind, I worked really hard for a number of years to bring HIV testing to this hospital, and had some bumps and bumps along the way. We tried to bring in oral quick sort of cheek swab type of testing using some partners clients, and we really didn't get anywhere. We tested about 0 people, literally about 0 people before this program started. So before 2016, we did not do testing in the emergency department for HIV. There was no routine screening. Through our front lines of the community of the United States Gilead partnership, we were able to bring in serum-based testing, and we moved that needle drastically and rapidly. We started to test from zero before, to about 1,000 patients per month for HIV, 1,000 patients per month. And my passion had been to bring in HIV testing. That's what I wanted to bring in. That's what I was really interested in. With it came hepatitis C testing. Something very interesting happened. I wasn't super interested in hepatitis C testing when we first started that program. I was interested in HIV testing. I grew up in an era where Magic Johnson, my favorite basketball player as a teenager, right, announced he had HIV, right? This was something that was on my mind all the time, given when I grew up. There was no treatment for a long part of my life when I grew up, and I saw those treatments develop as well, going through training and through medical school and getting more access to those treatments. So it was top of mind. So what was interesting, though, was that we were testing 1,000 people a month for HIV, and we were actually able to link them pretty well. There are good federal and state programs through state and federal leadership to link people to care for HIV. And we certainly want to see an expansion of those, but that worked really well. So our screening program and our linkage program was very successful. What became very interesting from that, though, was we started to see a lot of hepatitis C. We were screening for hepatitis C as well. Traditionally, we think about hepatitis C as a disease of people who were born between 1945 and 1965. In other words, the baby boomer cohort. Now, when I was in medical school, there was no real treatment for hepatitis C. There was a treatment that was available that was very difficult to take, and when you took it, it was only about a coin flip chance that you would be cured of hepatitis C. So it wasn't something we utilized very often. But what also changed were 2 important things. One was that the hepatitis C patients we were seeing in our emergency department were much, much younger than we expected. And we saw that happen very quickly. It happened within a year or 2 of our testing. So between 2015 and 2017, we started to see the age of new hepatitis C cases move down to people in their 20s. And of course, the reason for that is because there's a linkage between hepatitis C and infection and IV drug use. And we know that there is an epidemic, of course, of opioid use disorder. So eliminating infectious diseases like HIV and hepatitis C is tightly linked to eliminating the opioid use disorder epidemic and eliminating IV drug use. These things go together. So what I'm going to have some other people talk about as well, like Dr. McCoy, is what we realized was 2 things. One was that people who have hepatitis C, who are young in their 20s, but are also suffering from opioid use disorder or using IV drugs right now, they're not in a space where they necessarily care about their hepatitis C status. So how do we get them into a space where they can care about their hepatitis C status in a way we can cure their hepatitis C and also prevent transmission to other people? Well, we can do that by managing their opioid use disorder. I think Dr. Shepke may speak to us a little bit about some of the other programs we see in the state that we've also innovated here at Tampa General around starting medication for opioid use disorder in the emergency department and linking those patients to care. So we're managing both opioid use disorder and also screening and linking people with hepatitis C. We've seen really good results for that. We're able to basically cure both disease states. So moving into 2020, we're in a space where we've got a good program screening for HIV, linking those patients to care, screening for hepatitis C, figuring out that those patients often have opioid use disorder, trying to find a way to get those patients started on care for their opioid use disorder. But what we realized, there were still some missing pieces. We still had patients with HIV who had been lost to care. We had patients with HIV who were not being retained in care, who needed some outreach into the community. And we had patients with HIV who could spread HIV through through IV drug use. We also recognized that some patients with hepatitis C who had opioid use disorder were not at the place and time where they were ready to stop using opioids. So we realized we needed to do something different in the community. Governor DeSantis signed the Infectious Disease Elimination Act, the IDEA law, which allows syringe services programs, which expanded also our HIV and hepatitis C testing starting in 2021. Dr. McCoy will talk about that. So where we are now is we're in a space where we have really at Tampa General a coordinated regional harm reduction continuum that begins in the ED, works into this whole community in this area, and deals with screening and linking people to care for HIV, screening and linking people to care for hepatitis C and treating hepatitis C, and also dealing with the underlying issue around hepatitis C, which is opioid use disorder. So I'm going to turn it over to Dr. Kim, who's actually been part of her medical career has spanned the HIV epidemic, and I think has seen some really important changes around HIV screening, management, and linkage, and how that interplays with some of the work we're doing. Dr. Kim's our Division Chief of Infectious Disease and the Vice Chair of Research at USF, and it's a real honor to work with her. Thank you, Dr. Kim.
Thank you, Jason. So, I'm, as Jason very nicely said, I'm much older than he is. So I grew up in the HIV era where HIV was new. We didn't even know it was infectious disease at first. It was first reported in 81, 41 years ago. And over the past 4 decades, huge progress has been made. So when I was a medical school in residence, we frequently would tell people, don't get tested, you're going to lose your health insurance, there's nothing we can do, and stuff like that. So you can see the work of all of these people in the community, our public officials like Lieutenant Governor Nuñez, Surgeon General Ladapo, obviously my physician colleagues, people like Dr. Cho and Dr. McCoy, who have different backgrounds but are involved in public health, how much the community and the science and the medical community has really made a difference. So right now, we have highly effective treatments for HIV. We can cure Hep C. The federal government has made a huge commitment to ending HIV by 2030. So because the treatments have worked, companies like Gilead have been innovative and life-saving and also supported the community. We have a heart. So we need to figure out a way of getting people to those treatments. And throughout Tampa General Hospital and the University of South Florida have worked really, really closely. The clinical teams, the public health teams, the education teams have worked to provide testing and care for people in our community. We've been embedded into the community, work closely with everybody. And the FOCUS program funded by Gilead has been really, really important in providing the funds and the infrastructure to show that this was possible. It was successful, and it was saving lives. So we're incredibly delighted to have the support of Lieutenant Governor Nuñez and Surgeon General Ladapo here to recognize our success, recognize how important the work is, and also the commitment of the state of Florida to really continuing these initiatives. So as Surgeon General Ladapo said, 1 in 8 people are living with HIV and don't even know it. These are people who inadvertently could spread HIV because they don't know their status. Many of these people, aren't linked to health care. So obviously a big pillar of the ending HIV epidemic effort is to find these people, educate them, give them testing. And unfortunately, Hillsborough and Pinellas County are 2 of the counties that have been targeted for these important initiatives. We have a lot more work to do. Obviously, our counties have, a huge or more than we want HIV burden and new infection. But what's incredible is we have this incredible community of committed people that make this possible. And so, a lot of the people who have HIV and hepatitis, as Dr. Wilson said, are younger people who basically are not old enough to remember how devastating HIV can be, and also may not have their life together enough to really recognize what is risk and prevent themselves from getting these infections. But we can help them by working together. We can help them with substance use disorders. We can provide counseling. We can destigmatize testing and being positive. And, this is where Tampa General and USF are, very committed to continuing this work, continuing the focus program, expanding testing for HIV, Hep C, and syphilis. And you also probably know that, Tampa General is the major academic medical center in our area, the major safety net hospital, and we've been a leader in all sorts of different community health endeavors. As part of that, TGH has developed the Global Emerging Disease Institute, or JEDI. Many of you know the important work we've done with COVID, but that institute is committed to doing whatever we can to help people with important infectious diseases. So our commitment to working with people like Dr. Wilson in the ED, public health officials, to eliminating HIV, Hep C, and other important diseases that linkage to care is really important, is ongoing and will continue as we evolve from the post-COVID era. So testing is really, really important, and this testing day is, recognition of, all of our commitment to getting people into these life-saving treatments. And so we're really delighted, me, as a representative of USF and of Tampa General, to be part of this and have, these, officials really recognizing the work that we've done and also just putting their political muscle behind, getting this done. So thank you very much for coming.
So as Dr. Wilson was talking about earlier, I am an associate director for our needle exchange program, ID Exchange Tampa, and we really have a unique opportunity to really engage a very vulnerable population, substance using persons with substance use disorder, and also persons who inject drugs. And these populations don't always engage in the healthcare system, and therefore are not always having that equal opportunity to get tested for HIV and or Hep C. So just to give you some statistics, background, since commencement of ID Exchange Tampa in 2021, we've provided over 600 HIV and hepatitis C tests, and we continue to engage about 80 people monthly for HIV and hepatitis C testing. And in comparison to other syringe exchange programs, nationwide, that have about a 15 to 16% uptake in infectious disease testing, ID Exchange Tampa is upwards of 60 to 65%, which is really impressive. And I think part of our success for that has primarily been because we make HIV and hepatitis C testing a standard of care. It is incorporated into the services that we provide at ID Exchange Tampa. Every participant that comes to the exchange upon enrollment has a baseline HIV and hepatitis C test, and then they are followed up with testing on a monthly basis. So we've been truly, truly successful. And I think because of that, we've been able to really pinpoint that initial time of exposure so that we can, immediately link to care. And so we really thank, our collaborations with Focus and the Florida Department of Health and Tampa General and USF, because, and other, aid service organizations in the area, to be able to really just, pinpoint these exposures and immediately link to care. So thank you very much.
First, I'd like to thank everyone for coming today on National HIV Testing Day, and I want to thank the Lieutenant Governor and our Surgeon General for their leadership, and certainly thank our host, Tampa General and Gilead, for their focus program. As you've heard, this is really a best practice, and I'll tell you, as an emergency physician, I've really seen firsthand the devastation that HIV, hepatitis C, and opioid use disorder can bring upon both the patient, their family, their loved ones, and our communities. So to have programs like this that are best practices is really very heartening, and I too have been in practice for quite a long time and have seen a real evolution, and we're finally at the place where not only can we find the folks that have these disease, but actually provide significant pre-exposure prophylaxis, treatment, even cure for HIV, well, not cure for HIV, but treatment for HIV and cure for hepatitis C, but also treatment for opioid use disorder. So a program like this is something that the Department of Health is certainly very interested in expanding it with more public-private partnerships across the state to really help our state deal with this program, deal with this problem. Opioid use disorder is certainly not unique to Florida. This is a problem nationwide. And the medication-assisted treatment therapy with linkage to care certainly provides hope that has not existed for decades with this particular disease, and it's really gotten worse. And as you heard from Dr. Wilson, HIV, hepatitis C, and opioid use disorder, all three are linked and have significant crossover in their risk factors. Importantly, the emergency department and having opt-out routine screening for hepatitis C and HIV is critical because many of the patients that suffer from these diseases have limited access to care, and the emergency department ends up being the point of care for these folks. Importantly, half of overdose deaths occur within 3 months of an emergency department visit. So we know that intervening right in the emergency department is critical to maintain success, to save lives, and to decrease transmission. So again, I want to thank Gilead and Tampa General for hosting, and the Lieutenant Governor and Surgeon General, thank you for your leadership. And thank you all for being here today.
Thank you, everybody. I think we have time for questions if there are any questions.
Yeah. Yeah, well, I think that's an important point to hone in on. Under the leadership of Governor DeSantis, alongside our Department of Health, we've really brought, I believe, an intense and enhanced focus and attention on days like today. I mentioned Hispanic AIDS Awareness Day, National AIDS Awareness Day, National Testing Day. Those are all part of a broad initiative, a comprehensive strategy to address what we see, obviously, as a problem, not just here in Florida, but nationwide. There are roughly 53 counties throughout the country that have seen that uptick in new AIDS cases, new AIDS diagnoses. And so here in Florida, we're focused on not only the 7 counties within which we've seen those uptick in numbers, but also throughout the state, making sure that our county health departments, of which we have our Pinellas County Health Department doctor is with us today, making sure that our county health departments are working on issues like PrEP, making sure we have access to testing, working with our partners. So I think our budget has reflected the priority with the governor, making sure we provide additional funding where needed. And so I think that's part of our overall health strategy. Yes. I'm sure the department could probably speak a little bit more specifically to the numbers, but yes, yeah, thank you. All right, great. Thank you so much.
No problem. Thank you,
Take
Lieutenant
care.
Governor.
Yes.
Thank you. Thank you.
All right, thank you.